Thank you, Madam Chairwoman, and I agree. Great line of questioning there. So I was enjoying listening to the dialogue. Let me shift gears, Dr. Franklin and Dr. Gaudet. Earlier this year, Dr. Stone with the VHA stated that the VA had 60 active equine programs across the VA system and concurred that they are very effective in benefiting veterans. Last night, we heard from the National Institute of Mental Health, similarly, that equine-assisted therapy programs have some benefits in terms of mindfulness and other benefits, especially for returning veterans who are struggling with post-traumatic stress and other issues. I was very encouraged by Dr. Stone's statement that the VA is actively looking to expand equine-assisted therapy, as well as all of the VA's adaptive sports programs. Is equine-assisted therapy included in the services offered through the VA's Whole Health Initiative?
I can probably take that. Thank
Great.
you. The concept of the Whole Health Initiative is a broad umbrella. So while technically that doesn't fall under my office, really doesn't matter for this conversation. What matters is that the concept of supporting people's health and well-being and resilience through any means that is of effect and benefit for that veteran is a part of that approach.
Well, this is Kentucky Derby week, and horses are on my mind as a Kentuckian.
Course.
But I can tell you on a more serious note that throughout the calendar year, I have witnessed some really transformational things, positive things happen with veteran constituents of mine who have the benefit of access to equine-assisted therapy that may not exist in places outside of Kentucky, for example, and I encourage you to look at that. In legislation offered by my colleague, Mr. Lamb, there is a provision that allows the VA to report on the accessibility and availability of any other service the Secretary determines appropriate. If passed, Dr. Franklin, would you be willing to include equine-assisted therapy as part of this report?
Yes, sir.
Thank you. Let me shift gears to some of the cannabis-related legislation on the docket here today. Back to you, Dr. Franklin and Dr. Gaudet. As you may know, the 2008 Farm Bill took steps to deschedule industrial hemp-derived CBD products. And a lot of people don't fully appreciate the distinction that was made in the Farm Bill related to low THC CBD cannabis versus the high THC marijuana that remains prohibited under federal law. Given the passage of this legislation, has the VA given some concerns about the existing marijuana legislation on the docket today, has the VA changed their approach into researching CBD, low THC CBD treatments for veterans?
I will defer to Dr. Moll.
I'm not sure if that bill would have shifted people, but I think clearly investigators are interested in CBD oils. They're interested in low THC or no THC if that's possible. So I know that work is ongoing, and there's investigators interested in working on those types of products. The Farm Bill, I was having to run through some papers because we had some struggles with how to interpret the Farm Bill versus a Schedule I substance, and so.
Well, if I could,
Yeah.
To the extent the VA has concerns about the psychoactive impact and some of the studies relating to schizophrenia with marijuana, let me assure you that hemp with low THC doesn't present those potential risks, whereas CBD, which is now legal under federal law, may present an opportunity for the VA to take those incremental steps that you all were talking about in your testimony before. And the Farm Bill, just for informational purposes, does authorize the FDA and USDA to complete regulations. Those are ongoing. And once that is completed, I would encourage the VA to look at CBD as an initial step on this road to cannabis as a potential medicinal opportunity.
So just very quickly, I don't want to use your time. So what Dr. Franklin said earlier in the testimony was that our current study underway in San Diego is using CBD.
Okay, great. Thank you very much. And finally, just to the VSOs, Ms. Mullins, Mr. Fuentes, and Ms. Ilem, have you all had an opportunity to play a role in suicide prevention to the extent that I know your organizations can? We know from the testimony last night that far too many veterans who are committing suicide are not accessing, at least recently, the VHA system. Are you all do you feel like you all are able to reach those veterans?
I would say for DAV, we just recently had VA come over and do a SAVE program with us, training, making sure that our headquarters staff understands how everybody can participate in suicide prevention. And then we also included that now in our training for our national service officers who are located throughout the country and see veterans every day, assisting them with their claims. So we know and subscribe to VA's premise that suicide is everyone's business. We all have to play our part. We have to include this information in our magazines, our brochures. We have to talk to veterans, make sure that we're all taking care to watch out for each other. So I think, you know, we're doing what we can as an organization to spread that.
It's same thing for the VFW. We have one of those unofficial MOUs with VA, part of our mental wellness campaign, to essentially help veterans and their caregivers and family members in the community identify the 5 signs of emotional distress. Is a partnership with Give an Hour, Elizabeth Dole Foundation, and Walgreens as well, to bring people into our 6,500 posts around the world and train them, part of the Data Change Direction. So we're doing it, we're going to continue doing it, and VA is being a good partner.
Yeah, from IAVA's perspective, we operate a bit differently than the legacy VSOs over here, and we build online communities to engage our members in suicide prevention and mental health care, and we do that effectively and efficiently. I will also say that our Rapid Response Referral Program has an MOU with the VA as well, that they are master's level social workers that work one-on-one with veterans to do warm handoffs. So when a veteran calls our Rapid Response Referral Program in crisis, they're able to connect them to the VCL immediately. Last year, we had over 100 saves through that program. So it's an amazing program. We also have about 25% of our members that don't access VA healthcare. They do private health insurance only. So I can tell you that VA members, IAVA members, are definitely outside the VA program, and we are connecting with them with suicide prevention and mental health care.
Thank you. I yield back.